Welcome to the Power of Love show, sponsored by the D.D. Jackson Foundation, where we shine a light on loss and grief and how it impacts our lives. We are here to provide hope, resources, and a community so no one feels alone in their grief. Enjoy the show. Welcome to the Power of Love show, sponsored by the D.D. Jackson Foundation, where we shine a light on loss and grief and how it impacts our lives. My name is T.D. Jackson, and with me is my eldest brother, Taj Jackson.
What's going on, T?
What is going on, Taj? Today's date is Wednesday, May 4th of the year 2022. We are, of course, live on Facebook and YouTube, and you may be listening to us via podcasts. Yes, the Power of Love show is available on all streaming platforms for your podcast, whether that's Google Podcasts, Spotify Podcasts, all of those good ones. It is there. Now, saying that, Taj, I have to say, and I'm going to do this disclaimer, we are not licensed therapists. We are not doctors. We are just ordinary people who've experienced loss in our lives. We've been impacted by it, and we have learned from it. And we like to share our opinions in an attempt to help you get through whatever it is you are going through, saying that if you need professional help, we urge you to seek it and to find it. Taj, I will hint that we do have a wonderful guest today who is a doctor. And he's an awesome guy. We've been chatting with him. We are excited to have him on the show. And he is open to answering some of your questions on topics. So before we do that, though, before we introduce him and bring him on, I'd love to know, Taj, how was your week?
Week was great, T. Did a little photo shoot with my daughter, Toria, because her 1 year comes tomorrow. So we did a smash cake thing like we did for Taylor. So that was a little.
What's a smash cake? Is that where they just grab
the photo when they have their birthday cake and it's like you let them make a mess with it and whatever. So It was a little difficult to clean up, but it came out really well and all that stuff. But did that, and then basically been rehearsing. We've been, excited to say we got a big show coming up.
Yeah, as Constantine says, good luck with your show in Europe this week. Thank you, Constantine.
We're excited, right, T?
Yeah, I don't want to cut you off, but I do want to say
the big reveal is the braids are back. That's
you're going to reveal it on this show. Look at the hair. Taj, what year is this? Taj is going back to the 90s.
But it took a long time to put back in. Like we did them in sections.
Okay. And yesterday when I saw you, they were longer. So you just cut them too.
Yeah. We now we made them kind of where they are. They're still a mess. In a couple of days, they'll be laying perfectly. But right now, showtime, boys, right?
All right. So just to catch everyone up, my brothers and I, we have our first show since prior to the pandemic coming up this weekend in Strasbourg, France. So we're very excited about that. It's been too long, and we're excited to see our fans and to perform for you guys. So it's at a 90s festival that has some really cool artists from, I know people in Europe know Worlds Apart, and I think at least people in the States know Coolio. So there's all different types of artists that are coming, and it's a big 90s fest, and it's going to be a fun time. So the other thing, though, Taj, and I'm not going to talk about my week because that's been the big topic on my week as well as the show, but I do want to highlight a super chat we got from George. George, thank you so much for the super chat. It helps, of course, the foundation. And George says, thank you guys for the work you do, and wishing a happy 92nd birthday to Katherine Jackson. May the 4th be with us all. Very, very sweet, George, and thank you so much.
Yeah, very sweet.
Love that picture too, George, of that smile. It's very cool, man. Taj, I wanted to ask you one more thing, but my mind is going everywhere. But I will say this, Taj. The people are loving your braids. So love the braids, Taj. The braids are back. Clarice says, good looking braids, Taj. And Soleil says, love it, Taj, showtime. And then Angie says, wow, Taj, you look like your younger self again. It's nice to see the younger look again. And Sharon just goes simply with, wow, Taj. All right. There you go,
awesome.
Taj.
Thank you, guys.
We can't forget Lena. Love the braids. And Patty. Hi, Taj, in 1996, and Carol, I like your braids.
Yeah.
Geez, all this love for you, Taj. Okay, if I undo my hair, do I get some love too? Do I get some love? No, it's all good. It's all good. I'm just messing you guys. No, Taj's braids. When Taj gets those braids back, it means it's showtime.
Shout out to Tiana, my wife. She's the one that put the braids in, and it took a lot of hours.
Yeah, because you used to go and get it done, and it'd take like 8 hours, right?
Yeah. So we did this over about a week, little by little, in that way, and would watch a show, and then like a TV show on Netflix, and then she would do about an hour. So it took I don't know how long it actually took, but she's been doing them for about, the last 6 or 7 years at least. So chances are, if you've seen us in that time period, my wife's done the braids.
That's really cool, Taj. Someone actually made a point, Envy, who said, cool how you guys and Janet are making your first performances since the pandemic on the same weekend. It is cool, but the sad thing is we're missing a family wedding. I don't know about Auntie Janet's side, but for us, we had already committed to this date. So we have a precious cousin who's tying the knot that we're going to miss, and we couldn't, that we won't be able to make. I'll say it that way. So,
and we're also missing a celebration for one of our best friends' mother.
That's true, Taj. That is true. Very true. So it does come at a price, as they say, but we are still very excited to perform in years. So
yes.
All right, Taj. So I think that's good for the intro. I just realized I have a second chair here because we did the family roll. So, but it's cool. We'll just keep it like that.
Yeah,
we'll keep it like that. All right. You guys know how we do it here on the Power of Love Show. It's all chill. It's all relaxed. We have an amazing guest today. On today's episode of the Power of Love Show, we welcome a special guest, Dr. Alex Pantelyat. I hope I said that right. He will let me know. But from here on out, I'm going to just take the shortcut and just go by Dr. P. So actually, I'll say it one more time. Dr. Alexander Pantelyat is a movement disorders neurologist at the Johns Hopkins University School of Medicine, where he directs the Johns Hopkins Atypical Parkinsonism Center and the Johns Hopkins Center for Music and Medicine. This is real quick before I continue with this bio. This is when you know there's just another level of intelligence out there, because I like to think that I'm a pretty well-versed young man, and still these words are still challenging. But anyway, Dr. P's work is focused on the discovery and validation of diagnostic and prognosis biomarkers for Parkinsonian disorders and on music-based treatment of neurodegenerative diseases. Dr. P has been the primary investigator for DRUM PD, which is a controlled study of West African drum circle classes for Parkinson's disease, where significant improvements in quality of life were found after just 6 weeks of drumming. Parkinsonics, a controlled randomized crossover study of choir singing for support group attendance for Parkinson's disease, where objective voice loudness and motor improvements were found. Also, Guitar PD, which is a randomized delayed start study of group guitar classes in Parkinson's disease, where significant improvements in anxiety and mood were noted at the end of study interventions. And last but not least, Drum PD/HD, which is a pilot parallel group study of side-by-side drumming for patients with Parkinson's disease and Huntington disease, as well as their care partners. So, ladies and gentlemen, without much further ado, I always throw in the much, I can't help it. Please welcome the one and only Dr. Alex Pantelyat to the Power of Love show. Dr. P, how are you?
Fantastic. Thank you so much for this awesome introduction. And it's truly my pleasure to be talking with both of you today. I just want to start off by saying, having listened in the background, I hope that the smash cake experience went much more smoothly, for your kid, Taj, than it did for our firstborn, Jake. He didn't really care to smash the cake at all. Our girl, on the other hand, she ended up smashing it pretty well, so that made for some good pictures. Because let's face it, It's not really for the kid. It's for the pictures, right?
100%.
I'm curious to know, what did Jake do? Just stare at it? Did he take a bite? What did he do?
Eventually, with a lot of encouragement, because it was the first time he had seen a cake at that point, he ended up taking a little bit of a sample. But it was pretty underwhelming when it comes to the name, right? Because it's supposed to be a smash cake. Yeah. No smashing.
Ours is not that overwhelming either. I just want you to know that. So you're in good company there. Like,
Thanks for making me feel a little bit.
Love it. Love it. All right. So first of all, Parkinsonism. Did I say it okay that time?
Perfect. Again.
Okay. I've heard of Parkinson disease. I've never heard of Parkinsonism. I'm going to guess Parkinsonism is kind of having Parkinson, or is it, how would you define Parkinsonism?
So I'm just going to very briefly explain it and also clarify another term that people often confuse. So dementia, right? Everybody's been hearing about a lot. Dementia is actually not a diagnosis. There are reasons that people develop dementia, which means that they need help for one or more basic daily activities that people are expected to do, like driving, handling finances, remembering to turn off the stove, handling your medications, etc. So dementia is clinically defined as that inability because of memory or other thinking difficulties to do those things, people needing help. The most common cause of dementia is Alzheimer's disease, but there are a number of other causes that often coexist and combine in the same person to lead to dementia. Similarly, to answer your question, Parkinsonism describes what happens to a person who suffers from some combination of shaking, usually the hands, but it could be any body part, feet, tongue, neck, voice, plus muscle stiffness, so rigidity, muscle stiffness of the large muscle groups of the arms and legs, plus loss of fine motor control and coordination, not being able to move as quickly as you'd like when it comes to writing, when it comes to do anything with your fingers or your toes or feet. And finally, changes in posture, stooping forward, difficulty slowing when it comes to walking, and loss of balance. Those things I just described collectively are described as Parkinsonism. And the most common cause of Parkinsonism is Parkinson disease, just like the most common cause of dementia is Alzheimer's disease. But there are other causes to explain those symptoms that I just mentioned. And it's some of those other less common diseases behind Parkinsonism that I focus on. So those atypical Parkinsonian disorders that you were mentioning.
It's amazing stuff. It's okay. And then there was one more thing from the intro that I didn't know. I never heard of the disease Huntington. That's my first time in my 40 plus years on this earth of hearing the disease Huntington. Can you just briefly explain what that is, or give us an idea of what that is?
Absolutely. I'm going to start off by saying, since we're fellow musicians, Woody Guthrie would be one person you think of. He suffered from this horrible genetic disease. It's a disease that gets passed down from generation to generation, and having that Huntington disease gene on chromosome 4 puts a given person at, having a parent who has the gene puts one at 50-50 risk of developing the disease. Basically, you inherit the gene, you're going to get the disease sooner or later, depending on different factors. And so it's a disorder that spans both neurology and psychiatry, because there are changes in the brain that happen, and they affect somebody's mood. They affect cognitive function. So dementia, as I mentioned before, develops. So Huntington disease is one of the many causes of dementia, and a movement disorder. The classic description is called chorea, which is Greek for dance. So people have these extra dance-like writhing movements that are involuntary. They don't mean to make them. And eventually, people become dependent functionally on others, on care partners, in order to do even basic activities. And so, It's a gradually progressive disorder, kills within an average of 18 years from symptom onset.
Wow.
And, there's a big range there, but it's a devastating disorder that affects movement, affects personality, and affects cognitive function and thinking. So it currently doesn't have a cure. I should say this also in general, because it's relevant to what we're going to talk about with music. None of these diseases, Alzheimer's disease, Parkinson's disease, or Huntington disease, currently have a cure. And unfortunately, they don't have an intervention, a pill that can reliably slow down the progression of disease. So we have a lot of work to do in the clinical research and basic science community to ultimately find a cure for these devastating diseases.
Doctor, are all these fatal in that way? Everything that you've mentioned so far? I mean,
well, eventually. So Huntington disease is invariably fatal over time, although there's a range. I mentioned the 18-year average, but that there's a lot of leeway there. Alzheimer's disease, as I think most people know, is also fatal. Parkinson's disease is a bit different in that it severely impacts quality of life, but large studies haven't shown that it significantly shortens lifespan compared to people of the same, background and age, gender, who don't have PD. If it's going to shorten lifespan, it's about a year or less. By a year or less on average. But to contrast that with the atypical Parkinsonian disorders that you mentioned, those definitely shorten lifespan significantly. And in fact, in some ways, they're even more aggressive than Alzheimer's disease.
Got it. Okay.
We have so many great questions already, and I have a list of questions. But the community gets priority, so we're gonna go with the community. Denise wanted to know, Dr. P, is there anything in the pipeline that will help more than there is now?
Yes, of course. First of all, I want to give a shout out to your icon of support for Ukraine. I am from Kiev originally and came over when I was a kid in the early 90s, and I really appreciate the show of support. Thank you so much, Denise. There is a lot in the pipeline. I guess I'd have to clarify whether you're talking about Huntington disease, Parkinson's disease, or Alzheimer's disease. But regardless, the answer is yes, definitely. And it's not just stuff that's in the lab. These are compounds that are actively being studied in large, either national or multinational clinical trials as we speak. There are a lot of exciting mechanisms. That would be a separate topic for a show, but it's definitely a time of a lot of hope. The experience of Alzheimer's disease has given cause for pessimism because so many trials over decades now have not been effective. But I truly, truly believe that we are on the precipice of finding some effective treatment. So one example I'll throw out, phase 2 trial, which is still a small trial, but it's looking at effect in dementia with Lewy bodies, which is the second most common cause of neurodegenerative dementia after Alzheimer's disease. For the first time ever, they reported out, literally a couple months ago, the company reported out positive findings in improving cognitive function in this dementing condition, dementia with Lewy bodies. So phase 3 trial is coming up. The phase 3 trial is the large type of study that is used to apply for drug approval from the Food and Drug Administration in the US and a similar counterpart in the European Union. So it's not quite there yet, but certainly it's the most promising kind of finding that we've had so far in this disease period.
Constantine wants to know, what is the difference between dementia and Alzheimer? You said that is in the same family.
Yes, thank you again for this clarifying question. That's what I always want to parse. So dementia is really not a diagnosis. Okay, it's often described as such, but it isn't. It's simply one's difficulty from a cognitive thinking perspective with managing their daily life because somebody needs help. And there are many reasons for dementia. Alzheimer's disease is a defined cause of dementia. So it's called dementia of the Alzheimer's type, DAT in the medical literature, or sometimes shorthand Alzheimer's dementia. It's not the same thing because one is a diagnosis in Alzheimer's disease, right? It has a specific, we think, a specific cause of protein building up in the brain, wreaking havoc, and causing loss of brain cells. When enough brain cells are lost in particular regions of the brain, that's when people develop symptoms, the most recognizable being short-term memory loss over time. And so dementia is not a diagnosis. Alzheimer's disease is a diagnosis, which is the most common cause explaining dementia. But there are many other causes, one of which I just mentioned now, being dementia with Lewy bodies. So Robin Williams, who happens to be one of my favorite actors, was diagnosed after his death with dementia with Lewy bodies, to give you an example.
Okay, so like I said, and for the community out there, if you have questions, go ahead and ask them. I've highlighted some. There's a couple I want to ask before we get too far along, because I'm just curious to know, Dr. P. I almost said Dr. Alex, but I know either one works, but Dr. P sounds cooler for some reason. Dr. P, you've done such an admirable and impactful work, undoubtedly making a huge difference. What initially got you interested or inspired to go into the field of neurology, and what drove you towards movement disorders specifically?
Well, I am a third generation neurologist. So I had exposure through my mom early on. She had to do her training in residency all over again when we came to the United States. She trained in Philly, which is where I'm from, where I grew up. And I got to help her out at the office when she got started with her practice. So I kind of got to see the day-to-day practice of general neurology as a high school kid and a college student, because I stayed in Philly for college. And I liked what I saw. I liked the puzzle solving aspect of it. And then when it comes to movement disorders in particular, it's a subspecialty, a field within neurology that is especially focused on being able to take a history, see the patient, get to know the person right behind the disease, follow them over time. I find that very rewarding when it comes to being able to follow up with patients, and then being able to look at the examination, a brief exam, and based on your experience, have a good sense of what the diagnosis is and actually how to treat it, how to manage the symptoms, how to help improve a person's quality of life. In fact, often it just takes a video if you're experienced enough, and you could review a video and have a very good sense of what the diagnosis is and what to do about it. I really like that aspect of things. So between the ability to get to know people, say with Parkinson's disease over time, sometimes we follow they follow with us for decades, because like I said, Parkinson's disease doesn't significantly shorten lifespan. And being able to also really hone your exam skills as a doctor, as a physician, and rely on your history, how well you ask the questions, are you asking the right questions, and being able to diagnose people and manage patients just using those skills is something I find very rewarding personally.
Okay, so I know you are heavy into music, using music as a therapeutic way, and I'm going to get there, but there's just so many important, solid questions from the community that just to get a better understanding of certain things that I think is important. So Trisha wants to know, can dementia or Alzheimer's be caused by a trauma?
So short answer is absolutely yes. Again, just to be clear, Alzheimer's is a diagnosis. So Alzheimer's comes with specific proteins. For those who are interested, amyloid and tau. A lot of them are in the news lately. And in the case of tau, that's a very similar type of tau protein as builds up in football players, other athletes who suffer repetitive head injury. And a lot has been written about chronic traumatic encephalopathy, or CTE. But the lay public often doesn't realize that it's actually a very similar type of protein, also called tau, that we think causes CTE as causes Alzheimer's disease. And so, yes, trauma plays an important role. To bring up another situation, Muhammad Ali, who's such an incredible icon, suffered in later life from Parkinsonism, right? To use that same term, right? Because it's not the same thing as Parkinson disease, right? And also cognitive difficulties. And there's no question that brain injury, brain trauma was an important contributor. In Parkinson disease, there's research linking prior trauma to development of Parkinson disease. It makes a lot of sense. I mean, it's damage to some of those same centers that these diseases affect over time. So yes, trauma can contribute. In terms of whether trauma is causative for the majority of patients suffering from Alzheimer's disease, Parkinson's disease, other causes of dementia, we can't really say that. That would be saying, that would be going too far.
Thank you for that answer, Doc. Belen wants to know, or says, hi, doctor, can Parkinson's end up in Alzheimer's? And gracias.
Yes, un placer. So Parkinson, this is a great question, and now it's getting a little more into the woods. So when we are looking at the brain of patients who volunteer to donate their brains to research after they're done using them, and we're looking at somebody clinically diagnosed with Parkinson's disease. We do this every month at Johns Hopkins, my institution, because it's a very important thing to do to really get to the bottom of what's going on. About 25 to 30% of patients with clinical diagnosis of Parkinson's disease will have Alzheimer's disease changes, meaning the protein detectable in the brain, the protein of Alzheimer's disease, in addition to the changes of Parkinson's disease. Parkinson's disease is thought to be caused by a different protein building up in the brain called alpha-synuclein. And so what I'm basically saying is that a very large proportion of people who have dementia, meaning different causes, all-cause dementia, and who have Parkinsonism, actually have multiple proteins building up in the brain simultaneously that we can now increasingly detect during lifetime. But the gold standard for diagnosis, the end-all be-all as far as being 100% sure what's the diagnosis for somebody, is still, believe it or not, autopsy, looking at the brain under a microscope. So again, we got a lot of work to do in the science community to develop tests that are accurate at detecting these proteins before, at a time that we can intervene, that we could make a difference, right? Somebody's still using their brain. So that's actually what a lot of my work outside of the music part that we're going to talk about deals with. Biomarker development, better diagnostic biomarkers.
Patty wants to know, what does Michael J. Fox suffer from? That is Parkinson's, correct?
Yes, it is. That's correct.
Okay. Here's a question from Isabel. Is Parkinson's linked with depression? My dad had Parkinson's and he is also grieving, but I think he was getting depressed before.
Yes. So actually, again, it could be a bit more general here. Depression is an early symptom that precedes the obvious motor, the movement signs of Parkinsonism I described, as well as changes of memory that are seen in Alzheimer's disease. So often depression, especially in later life, where somebody did not have a history of depression, because usually that's early onset kind of problem, major depression. So if somebody has late onset, late in life, out of the blue depression without a clear trigger, like grieving for somebody, you really got to think about a degenerative disease, be it Parkinson's disease, Alzheimer's disease, or something else. But to directly answer the question, absolutely, for multiple reasons, people with Parkinson's disease and with other diseases I deal with often have what we call reactive depression, because they have a growing limitation to their ability of doing things and their quality of life. It stands to reason that they would have a reaction to it that would be feeling down, feeling sad, feeling blue. And that, by the way, is where I think music can come in and powerfully make a difference for these patients.
I love it. Okay, so a couple more questions, and we're going to get all into that music aspect. Cruz wants to know, what would you recommend for a 74-year-old woman who has Parkinson's disease? She's getting so depressed now, it's really heartbreaking.
So, as a Western medicine physician, I would be remiss not to say there are effective drugs, effective medications that are reasonably safe and should be tried. I have many of my patients with reactive depression of Parkinson's disease effectively treated that way. But on the musical side of things, these are some of the take-home points. Join a community-based choir. Attend a concert or 2 or 3 or 4. Join a community-based drumming group. These are examples of things that we have been fortunate to develop in the greater Baltimore community, which during the pandemic have gone virtual. And the nice unexpected effect of that is that people from all over, including internationally, are joining our groups, whereas in the past, it would be more limited. So join a group that speaks to you. Music, I'm going to be the first to admit my bias as a musician. It's not for everyone. Some people might do better going to an art gallery or going to a museum. My big dream, just to kind of take it there, in the next generation, is to be able to do what's called social prescribing. And that is, instead of just giving somebody a pill, or maybe in addition to giving somebody a pill, I could give them a prescription to join a community-based choir, to go to an art gallery, to go to a concert, and have it be covered by medical insurance. Wouldn't that be nice? That's the big goal here.
Okay, and again, I think we're going to talk about it at some point, but I have to know, what is it about music and art that is showing such positive, it's helping people? What is it?
Well, I'll just focus on music since that's really my area of focus. My role at the Johns Hopkins Center for Music and Medicine, which I was very fortunate to co-found back in 2015. The short answer is, and this is kind of also my neurologist hat I'm wearing, is that music activates more brain areas at the same time than any other human activity.
Wow.
It's hard to prove, as you might imagine, but I could show you a slide that usually my presentations, if you have different color circles overlaid on top of the brain based on the research that's already been done in the last several decades, mostly from functional neuroimaging studies like brain MRI, right? You've got about 8 different networks that are simultaneously activated just by listening to music. And then you've got additional things that are activated by making music, whether you're singing or playing a musical instrument. So there's a lot to unpack there, but that's really, for me as a neurologist, where the promise and the challenge of music both lie. The promise is that if you have so much of your nervous system being activated at the same time, if you are able to find ways to individualize, develop precision music medicine, if you will, then there's something in it for everyone if you could individualize the approach. On the other hand, the challenge from a researcher standpoint is, how do you really separate the effects of music and rhythm-based interventions on one network versus the other if they're being simultaneously activated? That's where we have a lot of work to do in the coming decades.
So these music-based programs and treatments for neurodegenerative disease, it's a tough word, neurodegenerative diseases.
Perfect.
How did you come to discover that music could be beneficial as part of a treatment program for someone living with a neurodegenerative disease?
Well, I'm just going to speak about my own personal experience. I was still in training in Philadelphia at the University of Pennsylvania, where we do they would do a yearly retreat with a South Philly-based community organization called Adunde 365. This is a West African drumming group. And so that year, that was the partner. And there was a 45-minute demonstration class for patients with Parkinson's disease from our center, and a charismatic instructor who taught them West African rhythms, just a little bit, get a taste. And it was remarkable because people were saying after this, I feel like this symptom of Parkinson's disease is better. I'm walking better. My overall mood is better. And it just kept going and going. And so I already, as a musician, had a bit of an interest, but it was so remarkable that I felt we needed to pursue this. So that's how the first study that we published, called Drum PD, came about. You briefly mentioned it in the introduction, where we took 10 patients with Parkinson's disease, another 10 patients who had their usual care as controls. And after 6 weeks of twice a week drumming, we were able to show quality of life improvements that were statistically and clinically meaningful. Very important, a very important other takeaway from the study was that we reassessed everyone 6 weeks after the drumming was over. And what we found is that those quality of life improvements kind of went back. Not quite to square one, but they were close. They were indistinguishable statistically. So what does that tell us? It tells us that whatever group you're going to join, you better keep up with it, because you're going to have things that you could gain from it, but you need to keep going in order to sustain it, right? As professional musicians, you realize there are lots of great quotes, right? I think Jascha Heifetz, I'm a violinist, so that's think about it. He said, if I don't play for one day, then I could tell the difference. If I don't play for several more days, the critics could tell the difference. And then for a week, the audience could tell the difference. And so you have to keep practicing in order to sustain the benefits that we are finding in these studies.
That is so cool. That is so cool. And we use music for our music therapy programs, and music has been, so helpful for those that we influence and try to help. And all this time, I'm thinking it's more from a writing perspective, because there's a lot of writing your emotions and what you're going through. But now that I think about it, just the idea of making music and drumming on rhythm and all that stuff helps as well. So it's really cool to hear all of this and exciting. For the music programs you are part of, what has been the most challenging part for implementing them?
Actually, that's the general answer from a clinical researcher's perspective is it's recruitment. And I would add to that equitable recruitment, because there are a lot of challenges when it comes to a clinical trial, right? A clinical study of any kind, in ensuring that all members of a given community, for me, it's Baltimore, have access to the studies and to these interventional trials. So I recognize we have a lot more work to do in terms of community outreach and being able to recruit people. So that's a general challenge that we have, apart from any music-specific studies. I am happy to tell you, though, that compared to most of the other studies, we've, I think, done pretty well when it comes to recruiting a nice and diverse array of community members. I think we could still do better, but it seems that music just speaks to people in a way that regular talking perhaps does not. It touches something. In the case of Parkinson's disease, you already highlighted this, with the drumming. The rhythm itself drives changes in the brains of people with Parkinson's disease and helps give people some of the rhythm back. And that could actually meaningfully improve things like walking and balance, and potentially even prevent falls, which for me as a Parkinson's disease specialist, is a holy grail, trying to prevent falls in my patients. So there's a lot to be gained. And, in terms of why is music, study after study, reducing anxiety, improving mood, in our own studies, it speaks to people in a way that I think regular support group, even contact is not going to reach everyone the same way.
These various programs you've implemented, I've asked you what the most challenging part is. Now I'd love to know what the most rewarding part has been.
I think, again, for me, we've starting with the Parkinsonics choir study back in 2016 that you mentioned before, we've had a blueprint that we intend to stick to. And that is, we're recruiting study participants from members of the Baltimore community, and assuming that people want to continue with the same type of intervention once the study is over, because, it's a finite number of weeks for any given study. We have to let people know this is how long the study is going to be going on for. Most of the participants in Parkinsonics, Guitar PD, the drumming study that we conducted, that was a pilot for the pandemic, they come to us, and before the study's over, they say, we would love to continue this outside of the actual confines of the study. And we've been fortunate but very motivated to give back to the community by enabling people to continue, and more people who couldn't make it into the study join this group. And so during the pandemic, that's been an obvious challenge, right, for any sort of clinical research for any of these groups. But Zoom has really been a helpful answer. Is it perfect? Of course it isn't. I don't have to tell you about that in terms of the Wi-Fi connectivity and issues of bandwidth. But it's been incredible because we really are able to expand these community-based groups beyond the immediate reach of Baltimore.
Yes. So there's so much. Oh my goodness. Okay, so there's so many good questions, and I want to be obviously respectful of your time, so I have to pick some. But before I go to the questions, I would love to know, before we channel into more learning about Parkinson's, Alzheimer's, and all that, I want to know, what do you hope to accomplish next in terms of, helping your patients find hope and healing in their lives post the diagnosis, I should say.
Yes, of course. So, just to give you an example, we're working with a company now on a pilot study, small number of patients with Parkinson's disease, 12 at our center, another 12 at Boston University, where we are giving them what's called closed loop or adaptive rhythmic auditory stimulation. And so what that means is they are given sensors that they wear on each shoe, left and right. The sensors detect their walking pattern. They communicate via Bluetooth to a phone that plays a playlist. Lots of funk. Funk is really overrepresented in this particular playlist, but that's just the current iteration of it. The idea is to let people listen to what they want to listen to. And the cool thing is that based on the individual patient's walking parameters, the music adjusts. So the tempo gets slower or gets faster, and then they have a metronome, like a tick-tock strong rhythm that's march-like, overlaid on top of the actual musical line. So you've got a rhythmicity that they're trying to encourage, and we call it entrainment in neuroscience, to entrain in the brain, which will translate to a more consistent step-to-step gait pattern, which is, we know that it's very important in Parkinson's disease to normalize that variability between steps, because it may reduce falls. So we're looking to reduce falls. What I would love to see is, of course, a bigger trial once we complete our pilot, and ultimately get this to be the first device, as the company is trying to develop it, to be approved by the FDA as a music therapeutic.
It's beautiful. Sue says, yes, music brings about stimulation to the brain, makes the brain stay focused on things like playing drums. And Sue also says, a friend has dementia. I play music of her era and she dances to it, takes her back in time with her dolly. And then we have to say what Caitlin says, as we always say in the DDJF community, music heals. Okay, so a couple of very good, I think, basic questions that I'd love to end with. And again, we won't be too much longer, Dr. P, but I have to know, and this is such a great question, because this is something I worry about. Both Taj and myself were brothers. It's pretty strong on our mother's side of the family, and I'm talking about Alzheimer's. I hate saying it out there because I don't even like putting it out there in the universe, but my memory isn't the best. Let's just say I don't brag about my memory. And Belen, I guess I would have the same similar question. Personally, Taj and I, we have grandmothers and older aunts that have all been diagnosed with Alzheimer's. So the question is there anything we can do to try to avoid Alzheimer's as much as possible?
Absolutely. So a couple things. Regular aerobic exercise, moderate aerobic exercise does have evidence of being protective for brain cells. And so that's the number one thing I would emphasize. 150 minutes a week would be a nice goal. So you have a weekly goal of 150 minutes. However you reach it, whether it's 30 minutes 5 days a week or 50 minutes 3 days a week. For dementia, actually, it's as little as 90 minutes a week. The 150-minute per week plateau is more with Parkinson's disease, but you could play it safe and aim for the higher goal. The Mediterranean diet. So for my patients, I say it's Italian minus the pasta and Greek minus the feta. My favorite things about Mediterranean diet. But in all seriousness, olive oil, fish, and lots of greens clearly seem to be protective. Surprisingly, for some, an educational level, if you're like at a point where, you haven't completed your education or you're thinking of taking additional courses, from my perspective, it's never too late. Lifelong learning is what we have to do as doctors to stay current. And that's really true for everyone, no matter what field you're in now. Everything's so fast paced. So whether it's expanding what you already know, in the case of music, somebody who played piano in their youth and maybe stopped playing, why not pick it up again? You're challenging your brain every day when you're doing that. And perhaps even more of a challenge, pick up a new instrument you've never tried. Pick up singing if you've never done it before. It was amazing in our Parkinsonics study where we selected people who were not exposed to prior group singing on purpose to try to have a more even playing field at baseline. People kept coming up to us and saying, I was discouraged by a teacher, by my parents, by family, saying, you're not really that good. You probably should avoid singing. Don't embarrass yourself. It's a real shame, right? Because that's really not what it's all about. Whether you're singing in the shower or playing an instrument for yourself, you are actually engaging with music in a way that changes your brain over time. And that's the thing that you really want to emphasize. And yes, there is growing evidence that it could be protective as we get older for various things, including dementia. Other than that, making sure that you're preventing stroke and heart attack as much as possible, because we know that so-called vascular insults to the brain are a big cause of both dementia and Parkinsonism, right? Those terms we've been talking about today. So that's actually the second most common cause of dementia after Alzheimer's, the stroke-related or vascular dementia. And similarly, vascular Parkinsonism is a very common cause of those same symptoms as Parkinson's disease causes. And if you could prevent yourself from getting strokes, you are doing a lot, actually. We now understand, to prevent dementia itself. So that's not to be forgotten.
And quickly, April wants to know, what about puzzles and word search? Does that really help?
The answer is it only helps if you actually enjoy it. This is a serious answer. So you've got to pick something that engages your mind, that challenges you, pushes you a little bit out of your comfort zone, ideally every day. And if you like crossword puzzles, I happen to like crossword puzzles, then that's great. But the best thing is to actually really try to go out of your comfort zone a little bit, just like with aerobic, with regular exercise, right? And push yourself, not too much to the point of injury, but just challenge yourself. So one thing I tell patients, everyday basis, think of one thing you could do today in your everyday activity that's a little different. So for me, recently I started trying to brush my teeth with my left hand. I'm a strong righty. And so that's like that right there, you're activating the opposite side of your brain than you're usually doing when you're brushing your teeth with your dominant hand. So do the same thing for writing, just for kicks. Do the same thing for using a fork, a knife, or a spoon. It's as simple as that. That actually is activating new areas of your brain that are not being activated to the same extent. So the basic idea here is building cognitive reserve, meaning in the face of developing a disease like Parkinson and Alzheimer's disease, we don't have a drug yet to prevent it, right? Try to make new connections, form new connections in the brain, which can be done at any age, by the way, whether you're 20, 60, 70, 80, or 90, new connections can be formed. That's important for everybody to know. Do something that challenges you, because that's more likely to build these connections over time. And taking it back to music, music is a very effective way to do that. I'm going to just say one of my favorite quotes is from Michael Tout, Dr. Tout at the University of Toronto, who's really a founder of neurologic music therapy, which is one approach to using music to help people with neurological disorders. He writes, "The brain that engages with music is changed by this engagement. That change is measurable now, and that change can in fact be a way to slow down the onset and perhaps to some extent prevent the onset of diseases like Alzheimer's disease and Parkinson's disease, because you're strengthening your networks so they are more resistant in the face of brain volume loss, brain cell loss over time because of these diseases."
Now, I assume when you're saying music, you're talking about playing or engaging in music. Is it as simple as listening to music? The reason why I'm bringing this up, because Carrie parlays that into a question saying, can playing favorite music help lift the sadness of someone with dementia?
Yes. So a lot more needs to be uncovered in terms of research to answer that question directly. But my bias is the same as yours in the way you asked the question, which is that if you're engaging with music by singing or actually playing, even better, making music with other people in a group, you are activating even more of your brain compared to just passively listening to music. And so engaging with music is a way to more robustly, more strongly to activate the networks in your brain that often are attacked by diseases like Alzheimer's disease and Parkinson's disease. And so engaging with music directly, actively, is thought to be a better way. That being said, to answer Carrie's question, playing favorite music can absolutely help lift the sadness of someone with dementia, as well as someone without dementia. This doesn't have to be conversation limited to people with dementia and Parkinsonian disorders, with Parkinsonism, because music-assisted relaxation is one of the most common things that we do without thinking about it. Right? Music is all around us. We put on music that we enjoy, that's individual to us, that doesn't have too much variability in terms of tempo, rhythm, pitch changes. That's the kind of music that calms most people down, but that's a generalization. And music that approximates our normal resting heart rate, around 60 beats a minute. That's, logically the kind of music that could calm a lot of people. But there's also this familiarity aspect of things, which is actually something we're going to be looking at in the coming year with my teammates here at Johns Hopkins, where we want to use music therapy with specifically pre-selected music, individualized music, over the course of 8 weeks, twice a week. And we're going to look for brain changes using functional MRI before and after the music therapy, specifically focused on autobiographical memory. We want to see if we could improve actual autobiographical memory in patients with early Alzheimer's disease and mild cognitive impairment. And we're going to, of course, look at mood, anxiety, and other measures as well. But our thought is that after 8 weeks, just 8 weeks, 2 months of exposure to music therapy regularly, you're going to have measurable, meaning lasting changes that we can detect in the brain.
Now, and Taj, I'm sorry, I know I'm hogging all of this, but I'm just so fascinated. And Doc, do you have 10 more minutes? Because I know I gave you a less time frame, but do you have 10 more minutes?
I'm happy to do this. The questions, as I told you before, are what I appreciate the most, and they've been wonderful.
Awesome. Okay, now real quick, here's a cool statement from Cruz. Our home is a treacherous one with stairs everywhere. Anyway, we can help her balance better would be great. She's getting bongos this week. So that is, I thought that was a cool, that was a cool one. Okay, so here's a couple of generic questions. We have Constantine back, and I know it's covering your face, so I'll just read it real quick. Constantine wants to know, when you put someone on anesthesia at the older age, can that cause or bring them Alzheimer's? My grandmother at her 90s, after she had hip surgery, when she woke up, she couldn't remember anymore.
Right. This actually gets at another concept that's closely related to what I was saying. It's called the resilience as opposed to reserve. So in the face of a major health issue, a challenge to one's health, right? Major surgery with general anesthesia. People who are predisposed to developing dementia, Alzheimer's disease, dementia in this case, it serves as a trigger to tip people over the edge. All of us have a threshold in our bodies, different organ systems. The brain is an organ like others. And once you reach that threshold, there's often like a fall off the cliff effect, as I call it. And so especially somebody who is already in their 90s, they're exposed to a major surgery and they're under general anesthesia for a while, there have been very clear links that predisposes to developing memory loss and, full-blown dementia type issues. So the question we never know in these scenarios, because I hear this all the time, right, from my patients, is would the dementia have developed anyway, but maybe later, and this just was an earlier kind of tip off over the edge. That's my sense, but hindsight, as they say, is always 20/20, so it's just conjecture. But yes, we see this all the time, and this is why, if it's possible to avoid general anesthesia for anyone, but particularly for someone older than age 65, you just want to think extra long and hard about committing to any type of surgery. And particularly inhaled gases seem to have more of an issue. So if there are procedures that you could do as what's called twilight, using IV and total IV anesthesia like propofol, this is something that wears off much faster and is thought to be a little bit more benign. Nothing's benign fully, but at least it's not putting someone under fully, and inhaled gases seem to especially be a problem when it comes to cognitive issues in older people after surgery.
Hot Street has another, it's a long question, so I'll put it up real quick so we can read it and then remove it. Hot Street wants to know, how come that people with Alzheimer's happen to remember memories from when they were really young, but forget everything else? They only seem to remember their childhood to their 20s.
So no, that's actually, we could answer pretty quickly. So that has to do with the anatomy of the brain regions that Alzheimer's disease affects. It affects new memory formation in several areas of the brain, the key one called the hippocampus. And so new memories really are challenged and are impaired and eventually don't form at all in very severe advanced stages. But what happens to our memory normally over time is it goes from the hippocampus, which is kind of like towards the middle, right behind the ears, if you think about the middle of our head, and it sort of moves outward towards the outer parts of the brain, the cortex, which is like on the outside, closer to the skull, right? And those areas in the cortex are preserved in Alzheimer's disease until very, very, very late in the disease course. So often people die of something else before those long-term memories that are distributed more broadly in the brain are ever affected. And that's why, it's the short-term memory that's the hallmark of memory loss. Yes.
And we kind of asked this, but I want to give Sweet Pea, in case there's something you wanted to add. Sweet Pea want to know, are there any vitamins or healthcare procedure people can take or put into practice before you get older to prevent getting Parkinson?
Yeah, so actually what I was saying about prevention of dementia, if you will, building cognitive reserve largely applies to Parkinson's disease. This is a bit of an aside, but unfortunately with time, people with Parkinson's disease are at high risk of developing dementia too. So not only do they have the movement related problems I talked about, but they do develop dementia. And so if you follow people, say 15 or more years from symptom onset of their Parkinson's disease, eventually 80% or more people will develop dementia. And so a lot of those preventive things, building cognitive reserve that I mentioned, very much apply to Parkinson's disease. So specifically, no vitamins. Lots of things have been looked at. Nothing that's recommended. Mediterranean diet, playing a musical instrument or singing. I'm serious about that. Whether something you did in your youth or picking up something new, even more of an impressive challenge to build your own brain reserve. And one thing I forgot to mention, but that's super, super important, social engagement. This is what's been challenged the most during the last 2+ years of the pandemic. People without dementia are clearly experiencing cognitive difficulties. Maybe some people who are listening in, tuning in right now, if you've noticed, not having COVID or anything, that's all separate, just by being shut in and having a lot less socialization, that you're less mentally sharp, it's not just you. That's true, because social engagement, the opposite, being around people is a way to keep your cognitive reserve and actually just be sharp. If you're around other people, think about it, consciously or unconsciously, you are sort of more toward your best, right? You want to engage with people and put your best foot forward. And when we don't have to do that, if we're cooped up in our home 24/7, that becomes a problem. So as much social engagement, safe social engagement as possible, is absolutely a way to build cognitive reserve. And we see this in our patients with dementia, of Alzheimer's type and others, and also with Parkinson's disease, where they just slip and take a big backslide during the pandemic, because without being infected by COVID, they just are less socially engaged. And so that's a huge problem, because that directly affects thinking.
Carla says, welcome, Dr. P. I have a colleague that suffered from tremors and subsequently blacked out in the office. Could they be symptoms of Parkinson's disease? And she wants to add, I have used music therapy with my students.
Yes. Thank you for that question. Now you're getting more and more complex. So there are lots of reasons that people could black out. Tremors certainly are one of the four things that I described about Parkinsonism, right? So the most common cause of tremors is either something called essential tremor, which is even more common than Parkinson's disease, or Parkinson's disease. Blacking out, though, is not a typical symptom of Parkinson's disease. If somebody has a blood pressure drop that's severe enough and sudden enough, you could black out, and that could be a symptom of Parkinson's disease or a related disorder, it's called multiple system atrophy, as well as several others. But without more information, I would be going a little too far when trying to explain it. So it could be, but the blacking out is definitely unlikely, unusual in Parkinson's disease.
And then two more questions, Doc, and then we'll let you finish off the show. As we said, you'll get that last say. I want you to make sure you get. This is a great question from Toria. Would you recommend to train your memory by doing memory exercises on a daily basis?
Yeah, this is similar to, I think, what was asked before in terms of specific exercises to train your brain. So no specific exercise has been shown to actually work, so to speak. But I suspect that if you're enjoying those memory exercises, then by all means keep doing them, because they're definitely not going to hurt. Whether they're actually going to help slow down or prevent or ward off developing Alzheimer's disease or other causes of dementia, we simply don't know yet. But if that's something you enjoy, then do it. So my example, I'm coming back to personal example. I like crossword puzzles from the time I was a kid doing it with my grandpa. And so now I'm starting to do it with my son, and it's something that I just really enjoy doing. And I don't see myself stopping anytime soon. But there isn't, I'm not saying that crosswords are the way to go. Word search is a great idea if you have fun doing it too. Just directing your attention, training. Right now I'm playing I Spy with my 4-year-old. And so that's really fun. He's already beating me. So I don't know what that really means about me. But that's really good too. So it's something that you really enjoy. That's the thing that I would emphasize. And again, that brings it back to music in my mind, because we already know from multiple studies that any intervention that's implemented, which could be helpful up front, you're going to lose ground very quickly. In Parkinson's disease, within 4 to 6 weeks of stopping any intervention, if you're not going to continue the exercises on your own at home. And music that you enjoy can be very motivating, activate those motivation, reward networks, reward pathways in the brain. And it therefore could really help people stay motivated when it comes to doing exercise, when it comes to just being engaged with music-based activities themselves. And that's really a very important aspect of what music can do, keeping people engaged.
Do you think, as April said, do you think that stem cell research could possibly create a cure for Parkinson's and Alzheimer's?
Short answer is yes, possibly. With Parkinson's disease, there have been some recent exciting trials. I mean, early trials in the 1980s actually, in retrospect, had a little bit of a positive, promising signal. We're not there yet in terms of actually doing these procedures, having them approved, but definitely there are some exciting developments, particularly in Parkinson's disease, where you're directly implanting stem cells into the areas of the brain that are devastated by Parkinson's disease. Too soon to tell whether it's going to be a cure, or a meaningful treatment for large numbers of people with Parkinson's disease, though.
Okay, and then I promise you this is the last question. It's just I think we had more questions after hundreds of show on this show. They're into what you're saying, so that's a true testament and compliment to you.
Thank you so much. I'm honored
of the impact you're having.
Thank you.
Sue asked this question, I think, 4 times in the chat. So she wanted to make sure we understood or asked it. And truthfully, I don't even know what this means. So I'm going to try to read it, but I'm hoping it's making sense and there's an answer to it. So Sue wants to know, how does botulinum injections help involuntary movements?
Let me make it.
Yes, please.
Let me make it easier. The question is about Botox.
Okay, that's what I was figuring. So
that's just a fancy way, right? And it is the correct way, by the way, to describe it, because Botox is a brand and there are multiple other competing brands on the market. And yes, the question is very well directed. As a movement disorders neurologist, I use Botox and other types of botulinum toxin to help people who have a range of involuntary movements of different kinds. So very short answer. You guys, people tuning in are familiar with muscle relaxants. If you have muscle, spasms, right? There are medications that can be prescribed for them. Botox is an injectable muscle relaxant. And the advantage of having it be injectable is that if you do it the right way, it's not going to spread throughout your body. It's going to stay pretty much where you injected. So you're not going to have some of those sleepiness and balance and other side effects that the pills that people take for relaxation of muscles can cause. And so Botox helps involuntary movements by relaxing the muscles that are making those movements and actually weakening them to some extent. And so if the muscles are more relaxed and they're weaker, then the movements are going to improve. So the problem with this approach is that it's temporary. Botox, just the same stuff as for wrinkles, exactly the same stuff we're talking about here. It wears off. On average, it lasts between 10 and 12 weeks, depending on the indication. And so that means that patients have to keep coming back to keep getting these shots. But it's absolutely an important tool in our toolbox of movement disorders neurologists, which is something I use quite a lot.
Doc, Taj, and I'm sorry, I took all the talking and the stuff, Taj. So if you wanted to ask something or say something, now's a good time before we close.
Just real quick, in terms of the decades, have you seen an improvement in your expertise? You talk about science and trials and all that stuff. How much have we improved in terms of learning about these things in terms of over the decades? Because you mentioned the 80s at one point. Now we're 2020s ish. Is there progress to the point? I know it's not as fast as we would want, but are we still making progress in that way?
You're asking really the big question. Saved it for the end. Going out of the bang. So for me to do what I do well, I feel I need to be an optimist, and that's my natural disposition, as you could probably tell. I don't think I'd be able to really do what I do if I weren't one. So the short answer is there's been a huge amount of progress, whether it's better diagnostic tools, better treatment tools. Yes, that even includes dementia. And in terms of what's on the horizon. So, I mean, in the 1980s, there was really one drug for Parkinson's disease. Now there are over a dozen. So in that sense, you could see it as a bit of an explosion. Do we have a lot more work to do? I hope our conversation today has made it clear we have a lot more work to do, both on the diagnosis and treatment side. Alzheimer's disease, lots of disappointment, as I mentioned, but they're clearly moving in the right direction. I mean, if it's not the Aduhelm drug that was controversially approved a little while ago, there are drugs lining up right behind it that block the buildup of at least one of the proteins that we believe contributes to Alzheimer's disease. And I think they're going to get it right eventually. So we're not there yet. There's been a lot of improvement. One thing that I would really highlight is there is a growing understanding and recognition on the part of the general public in terms of Parkinson and Alzheimer's disease. Clearly, that's a responsibility that I take upon myself, and also members of the scientific and clinical community, to better educate people so they understand these differences, dementia, Alzheimer's, et cetera, because it's important, right? Because often that does affect the way that we approach management and how we talk to patients. So I think that that's definitely been improving, but I think we have a lot more work to do. And level of public awareness, raising awareness of these illnesses.
Nice.
Dr. P, what else can I say besides a huge thank you on behalf of my brother, our foundation, and our community. It was so informative. I'm going to, before I highlight some comments to show the love from the community back to you, we always, as I mentioned before starting, we always give our guests the final word, the final say to talk about whatever they want to talk about. I have an idea in the direction you may go, but I do want to preface it by, in case you don't go this way, you could talk about anything you want. You could talk about your favorite Netflix show. You could talk about your cooking recipe, anything you want to share with our community. Now is the time to just, the floor is yours, Doc. So whatever you want to say to the community, anything on topic, off topic, whatever you want. We'd love to hear it.
Thanks so much. I just want to reiterate the quote from my colleague, Dr. Michael Tout, because I think it just powerfully speaks to so much of what we've been talking about today. And that's the brain that engages with music is changed by this engagement. That comes to the way that's talking about the way the brain functions, and also the actual structure of the brain that we can now measure and see for ourselves using MRI and other imaging techniques. So by engaging with music actively, right, you can really make a change in your brain, and you could really make a change in your life over time, whether it's to reduce mood symptoms, to make yourself feel happier, whether it's to bring up memories from long ago or recent ones, hopefully positive memories, whether it's to use rhythm to walk better, as has been used in patients with Parkinson's disease, stroke, and now multiple sclerosis more recently. The list can go on, but there's something to be gained for just about everyone, no matter whether there's a specific illness, neurological, non-neurological. That's why our center is called the Center for Music and Medicine. It's not just neurology. We focused on that today in our conversation, but music could help reduce preoperative and postoperative anxiety. We showed this in a recent study in men undergoing radical prostatectomies at Johns Hopkins, which is a very painful procedure and is a very anxiety-provoking procedure for men. And so music could make a measurable difference in terms of anxiety and in terms of pain control, apart from any medication use. So there's something in it for everyone. And what I would encourage everyone tuning in is to engage with music and to really spread the word that music and rhythm can meaningfully change the way that a person's brain can function at any age, whether you're 2, whether you're 20, or whether you're 90.
That's beautiful. Love it, love it, love it. So we've started at the end of recently we've started showcasing some great comments just to thank you, Doc, for your time. Dilla says this was very informative. Thank you so much, Dr. Pete, but it's Dr. P, but it's okay. Sine says, thank you, Dr. P. Let's see who else we have. We have Lena, who says, such an informative live. Thank you for sharing your knowledge on all the various diseases. We appreciate you coming on today. As many of us know someone suffering the effects, it's good to know more. Carla says, thank you, Dr. P, for your research and all that you do. Georgina says, very positive, doctor, smart and charismatic. And Sue, will finalize with Sue, says, thank you, Dr. P. Simple thank you, Dr. P. Now, there's a couple of things before we let you go, Dr. P. I just want to again thank you on behalf of Taj, the foundation, our community. This was, I want to say, the longest, in a good way, episode we've done because the questions were just flowing in, and it was a great episode. Before we close out, there's a couple of super chats that we always highlight. If someone's going to donate, we have to highlight. It's a heart from MH, and then Sine also says, hey, this is so off topic, but Taj has braids now. I'm glad to see him going back to the Brotherhood era. That's my favorite era song and album by 3T. So yes, Sine, Taj is back in the braids, and as we said in the beginning, we are doing our show. But that's it, you guys. Thank you so much, so much, Dr. P. You are welcome back anytime. Our community loved it, and you really informed not only myself and Taj, but like I said, everyone. So I appreciate you, and God bless you, really. Okay, Taj, anything you want to say before we wrap up?
No, I mean, I learned so much in general. As you know, this affects our family
Yeah.
it affects everyone. Pretty much
Yeah.
everyone knows someone that this affects, but I was mistaken by a lot of stuff. So I appreciate you coming on here and informing us. This was a great show.
Thank you so much for having me. Really, I appreciate it. And I want to wish you the best of luck with the performance. It's a big deal.
Yeah, we are excited, Dr. P. So thank you so much. All right, everyone, we are closing, and thanks for being with us. We will see you guys next Wednesday at 1 p.m. Adios, everyone.